with the latest weekly figures for England and Wales added to the last weekly totals for the rest of the UK. The death toll, as of just over a week ago, because of the lag in reporting, was more than 38,000. And of course, there have been many more deaths since. So tonight, we're now looking at around double the 20,000 deaths figure that the UK Chief Scientific Advisor said would have been a good outcome back in March. A truly worrying picture, particularly in care homes. The Health Secretary in England today said the number of deaths in care homes was coming down, as it is in Scotland. But the latest weekly figures show over half the coronavirus deaths in Scotland, and over a third in England and Wales were in care homes, where testing, we hear, remains an urgent concern. And tonight we've been filming with the largest care home provider in the UK, HC1. At least 38,000 dead across the UK, around 10,000 in care homes. It is a tragedy.
I've seen people who have easily had 5-10 years left die in 4 days.
Every day somebody died, every day.
This is Highgate Care Home near Glasgow. Since March, more than 1 in 4 of their residents have died. How hard was it for you to see them deteriorate?
It's so hard. It's very, very hard. You build up a relationship with these people, and up the stair we've lost quite a few big characters. And you miss them, and still miss them.
Highgate is part of HC1, the largest care home provider in the UK.
Hello. Hi, Jennifer. Hi, Jennifer.
This is the first time in this pandemic they've allowed media access to one of their homes. Inside, the staff are filming themselves.
So you're getting fed up looking at the staff with masks on, Bill?
Jennifer, a nurse and the care home manager, is taking blood from 79-year-old Bill.
We're all coming in disguise now to see you, aren't we?
How does it feel about your room now? We're spending a lot of time in your room.
When coronavirus infection tore through this home, likely in late February, mask wearing wasn't routine. Life for all of us was largely as normal. But Highgate would soon be among the first care homes to suffer a major outbreak.
How are you doing, okay?
Nobody had dealt with it in Scotland in a care home. We were the first, so it was very difficult to get anybody that could give you advice 100%.
The guidance around wearing masks with all residents was clarified on April the 9th. By April the 9th, how many people had passed away here?
There were certainly lots of residents had passed away by that point.
The worst of the outbreak in this home and in many other care homes across the UK appears to have occurred when there were far fewer measures in place than there are now. Even by mid-March, carer Andy says Highgate was already overwhelmed.
It wasn't chaos, but it was chaotic. It was the guidelines and things were changing daily. We saw this coming as a country. We saw it coming, made a head start on other countries. It was just like, be prepared. Well, help us prepare. That was what I was saying, help us.
Soon, Shona, a nurse, was seeing a death a day.
Usually when somebody is health has declined, we have an action plan. As nurses, we have an action plan, we do a care plan. This is how we're going to deal with it. This is how we're going to look at the symptoms, the signs. This is the medication we're going to put in place. And this is what we're going to do. And all we could do was prepare these people to pass. No.
They say they know how the virus spread here. Residents with dementia can't be cared for without close contact.
Me personally, I can't see how a virus like this can go from one end of the home to the other end of the home when both of these people are in their bed. The only reason I can think of is that it's us. We're the carriers. I think
the Scottish Government announced that all staff would be tested in care homes with any cases of COVID from May 1st. The last coronavirus death in Highgate was May 4th. By then, 22 residents had died.
As soon as it was a confirmed case, I think we should have all been tested. I think we should have been tested and had the proper equipment straight away to minimise the spread.
Have you been tested?
No.
You've still not been tested?
No.
There are no confirmed cases currently at Highgate. The vast majority of staff have not been tested. Care homes are reporting troubles with testing across the UK.
Can you be certain, based on the level of testing there's been, that either the staff or the residents don't have coronavirus?
No, all I can do is look for the symptoms.
Today's figures indicate that for the last comparable week, the percentage of care home deaths was far higher in Scotland than England and Wales. Nicola Sturgeon questioned the figures as thousands of excess care home deaths across the UK are currently unexplained by COVID-19.
I'm going to do something now that I probably shouldn't do because it is speculating. Perhaps it is that more of the excess mortality is being attributed to care homes in Scotland than it is elsewhere in the UK.
There have been hundreds of deaths at homes run by HC1. Its chief executive says they've not always got it right. But Highgate had the unwelcome label of being one of the first hit.
People were horrible to us, horrible. Basically making it out as if it was infection control and hygiene, when clearly it's not the case. It's a global pandemic. You're in here, busting your guts, trying to do the best job you can, and folk have just got negative things to say. They don't know what we're in here coping with.
Challenges remain. Care homes across the UK have struggled with residents coming to them from hospitals. In Highgate, they won't take anyone who doesn't test negative first. They've learned to live with the virus here in the toughest possible way.
We all cry all the time. And this should be a happy place, and it is a happy place. But we need to be really careful. We need really, really careful. What I don't want is for Corona to be back here.
Thank you.
Kieran Jenkins reporting. Well, now our health and social care editor, Victoria McDonald, joins us from the newsroom. What more do we know about the virus and why it has spread so significantly in care homes, Victoria?
It's almost hard to know where to begin, but you heard there was a particular point that Karen just mentioned just now, which was about care homes now not taking patients with COVID-19 unless before they've been tested. But the fact is, testing didn't start for a long time and still isn't happening in some cases. Now, let's go back to the beginning. What we know that happened at the beginning was that hospitals discharged patients en masse into the community in late February, early March, and probably later, trying to clear the beds for the wave of COVID-19 patients that were going to come in. Now, they were not tested, and testing in England certainly didn't start till April the 16th. You also heard Karen talking about the fact that you can't look after a patient with dementia without getting close up. But the fact is, and we know this again, there wasn't enough personal protective equipment going into these homes. There were untrained staff, and that is not their fault. And there were also 0-hour contract staff who were having to move between jobs and homes. So we don't know what was happening there. There was an inability to segregate the patients. I mean, you name it, there were any number of problems, and it should have been anticipated to a certain degree because we knew these were the most vulnerable patients.
Well, today, Victoria, we had the weekly death figures from the Office of National Statistics. What did they tell us?
Well, Professor Sir David Spiegelhalter from Cambridge University has been talking about, he calls it collateral deaths, because what we are seeing is a consistent 25 to 30% of excess deaths. That's more than deaths over and above what you would expect for an average at this time of year. 25 to 30% that are non-COVID related. Now, because that has remained consistent, this then begs the question, is this people too scared to go to hospital? Is it ambulances not being called or ambulances not coming, GPs not turning up, symptoms not being recognised? Now, if it was that people just weren't recognising the symptoms of COVID, you would have expected that 25 to 30% to change, but it hasn't. Now, the ONS is having a look at this. They won't be able to say exactly what caused this. That they will be able to see what these people perhaps were dying of instead, whether it was heart disease or cancer. And again, there will need to be an inquiry into this because this is a very serious number of deaths that are excess.
Our Health and Social Care editor, Victoria McDonald. Well, joining me now is Sir David Behan, who's the Chief Executive of the care home group HC1, featured in our main report tonight. Sir David, can I begin with that point that Victoria was just talking about, which is excess deaths, not from COVID-19? This must be something you're experiencing as well, statistically. I mean, are you finding that residents are not getting the normal medical care that they would in normal times?
Well, excess deaths are up over and above what would be the normal seasonal average across the care home group, and have been since the trend began in February, continued through March. But what we've been seeing since the middle of April is a declining number of deaths in our care homes. At its height, we'd got 82 COVID-related deaths a day, on one day, sorry, in the middle of April. But as of yesterday, the figure was 8 COVID-related deaths. So we are seeing that decline. But as you're quite rightly pointing out, there have been deaths other than COVID-related deaths, and they've been above what the seasonal average would be. We think this is because, particularly during March, the number of transfers of residents between a care home and hospital reduced quite dramatically. The only people that were transferring from a care home to a hospital if there'd been an accident like a fractured neck of femur, or indeed it was COVID-related.
Right, so what about transfers going the other way, which is believed to be a big cause of infection of care homes, of people coming into care homes without you knowing whether they had the infection or not?
So there undoubtedly, in the early days, were transfers of people from hospital who perhaps were COVID positive, who came into the care homes, and that could be one of the routes of transmission. But I think one of the key issues here, and we can all be wise in hindsight, but one of the key issues is beginning to understand that the transfer of this virus is often by people who are asymptomatic. And this is why testing of both residents and care home staff has been a hugely important development, and will be as we go forward, if we're going to sustain the progress that we've been seeing over recent weeks and not see a return of this virus into some of the homes which are now clear.
But we saw the staff in that piece saying that they hadn't been tested. So what proportion of your staff and asymptomatic residents have been tested?
Well, what we're seeing is we're at the beginning of the testing being rolled out into care homes. We've participated in the pilots, and over 91 of our homes have been involved in the all-home pilot. But we've got over 300 homes, and we want to see regular routine testing available for all staff and all residents, and that being available in a sustained way.
But is it a minority at the moment? Is it still the overwhelming majority of asymptomatic patients and staff tested? Even though Matt Hancock said that they should be from now.
Yes, so that testing is beginning, but today the current numbers that we've got of colleagues that have been tested is about just over 3,500, and residents tested is about 5,500. We've got over 20,000 staff that work in our homes, and 17,000 residents. So we are at the beginning of the rollout of the testing, but this is key. In addition, what is also key is making sure staff have the appropriate personal protective equipment, that we've got good hygiene.
And do they have it?
Place. Well, we've been lucky. We're a large company, and we've got an excellent head of procurement who's ensured that we've both had adequate stocks and supply of PPE coming in. And as the guidance has changed, the point that was being made about providing intimate care for people with dementia, we've upped our procurement and made sure that we've got eye protection. So we've kept pace with that guidance. But we're a large company, and there's many, many small organisations in social care that might not have been able to benefit in that way. The other thing we've been able to do is ensure that training in the appropriate use of PPE has been available for staff. I make the point that we've not dealt with a virus before that presents asymptomatically and disproportionately affects older people with underlying vulnerabilities. So many of us are dealing with this for the first time and beginning to learn from our experience about how best to do this. And as I think
we must leave it there.
Staff have been fantastic in their commitment and dedication.
Thank you very much indeed for your time. Thank you.
Thank you.
Now, police are tonight investigating the death of a railway worker who was assaulted by someone claiming to have COVID-19. Belly Majinga was working at Victoria Station in London when she and a colleague were approached by a member of the public who spat in their faces. Both women subsequently fell ill with coronavirus. Downing Street described the attack as despicable. Our chief correspondent Alex Thompson has more.
It was the day before lockdown, March the 22nd. Her family say Belly normally worked in the ticket office at London's Victoria Station. They say her manager insisted she worked that day on the concourse, despite her saying she had health problems.
A man approached them to say that, why are you here? They say, we're on duty, we are working. And he said, you should have been working. And he said, I've got COVID, and then spat at her.
Govia Thameslink Railway says it takes the allegations seriously and is investigating. The police say they had no record of any complaint at the time, but opened a new inquiry yesterday.
Belly begged to not be sent back out onto the concourse. And she had to go back out. And our concerns are, and I think questions have to be asked as to why she was working when she had an underlying medical condition, and whether the task that she was being asked to do was essential or not, and if it was, what protection she should have been given.
A few days later, Belly and a colleague also present fell ill. Belly died on April the 5th, aged 47, leaving her cousin Agnes, 11-year-old daughter Ingrid and husband Lusamba.
There's a deep hole now. We know she's not there. It's very difficult to think she's not there. It seems like she's still gone on holiday somewhere, she'll come back. But no, she's gone. She's gone. It's very painful. Very, very painful.
One incident lasting perhaps seconds, and a hole gouged forever into a family living quietly in the suburban fringes of London. As Belly's family agree, nobody can say for certain whether the events that day at the station caused Belly to die in the way that she did. That's a matter for the police and then, of course, the courts to determine. But we do know already during this pandemic that the legal view is that any action like that by anybody would constitute, at the very least, a serious assault. It is scarcely a comfort, but Belly's family hopes that publicising her untimely death today may lead to an arrest, regardless of whether or not that assault ended her life.